দর্শক মণ্ডলী আমরা আবার ফিরে এসেছি অনুষ্ঠানে আমরা আবারও তাদেরকে প্রশ্ন জিজ্ঞেস করব Dr. Chen, can you tell our viewers how can they protect themselves from not having gallstone?
Okay, actually the gallstones form, like I say, in certain groups of patients, and one of the best ways to prevent gallstones is to eat regular meals. Okay, irregular meals are something that do predispose you to forming gallstones. That when they decide to go on dieting fads, and these are very common nowadays, to take the dieting fads with some precaution, not to jump straight into it, to take it gradually, because when you have a sudden change in the type of food that you take, that changes the constituent of your bowel. And if it changes the constituent of your bowel suddenly, that is what makes the bowel more likely to form stones. But other than that, actually, like I say, regular meals, a healthy diet which is balanced, and when you go on a diet, not to go drastically into a crash diet itself, because these things make you much more likely to get a gallstone.
Okay, thank you. But there's another question which I would like to ask you. Sure. I have seen lot many patients like who are 18 or 19 years old, they might be having gallstone. What is the reason for them to have gallstones?
There is one of the causes of gallstones I didn't touch because it's not as common.
Okay.
But the patients who have hemolytic conditions, sometimes if they are, for example, they have a thalassemia trait, where they have a more rapid turnover of their red blood cells, but they are perfectly normal. Maybe the blood counts could be a little bit low.
Okay.
But if they have conditions like that, that is a common predisposing factor for having gallstones, because when the red cells break down quicker, the hemoglobin is broken down, and one of the constituents of the hemoglobin goes to making gallstones more likely.
Okay.
So many of the young patients who have gallstones have an underlying reason for it, and it's usually something like a thalassemia trait.
Okay. Thank you. What about liver transplant? I mean, I'm sure you do it in Singapore. Could you just tell our viewers that how often do you do and how successful you are in doing that?
Okay, we're going for gallstones all the way, which is the other end. Yeah, okay.
Because we have time constraints, so I have to ask.
So the liver transplant, we do two types of liver transplant in Singapore. We are quite fortunate. We have a cadaveric liver transplant program. What that means is that when a patient has a damaged liver, which can no longer function well, or has cancer of the liver, they are able to get a brand new liver from someone who is deemed brain dead. Okay. I think that's not available in this country, but because of religious reasons. But in Singapore, we can, even for our Muslim population. They are able to donate their livers in entirety. Of course, we need to get permission from them to salvage the patient with the damaged liver. But this is a very limited source. In Singapore, it's quite a safe city. There are not many accidents, and not many people have brain damage with a normal body.
Right.
So in Asia and Singapore the same, we have moved towards something called live donor liver transplantation.
Okay.
That is when you are able to take half a liver from a healthy individual and replace that into the person with the damaged liver.
Right.
Yeah. The reason you're able to do this is even if you remove half the liver, both in the donor and the recipient, the liver will regrow in a period of about 6 months to its original size. Because the liver is the only organ in your abdomen and your body that's able to regenerate itself. So this is one of the peculiarities or the perks of the liver, and doing the liver transplant, removing half the liver and placing it into the patient with the failed liver. Both are done equally commonly, perhaps living donor more commonly than cadaveric liver transplant in Singapore.
How is the living donor giving it? Is it like a relative or?
We preferably would like the relative or somebody who is emotionally very close to the patient to donate their livers. But in Singapore, they do allow altruistic donation. We do take donations from, for example, monks who give their livers because of religious reasons. And even earlier this year, we had a very famous case in Singapore where a taxi driver who gave his liver to somebody he did not know, because they put an appeal out on the social media for a liver, and he actually came forward. This was quite well publicized in Singapore. So you do not need to be related. You don't even need to know the person, but if you can prove that this is a genuine reason that you're not doing it for money, or you're not doing it to increase a certain status.
It's for a cause.
Yeah, for the cause. They will approve it on a case-by-case basis.
Oh, that's lovely. It's quite an eye-opener.
Yeah.
Thank you so much, Dr. Chuang.
Yes.
As you said, lifestyle plays an important role. So what about an elderly patient? Like, is it very late for the elderly patient to start doing exercise? And if so, then how should he start?
Now, first of all, it's never too late to start watching one's lifestyle, whether it's young adults or elderly citizens. Now, lifestyle can take the form of watching one's diet. It can also take the form of exercising more often, and also it's never too late to stop smoking. All right, because I forgot that to mention that smoking is one of the big cause of coronary artery disease, and many youngsters are getting it because they are smoking earlier in their life. Now, in terms of exercise, now in general, all forms of exercise are good. The only exercise that's probably not that good is you walking to the buffet table and helping yourself with more and more food. Now, you can start from simple things like walking in the park, brisk walking in the park. Now, in general, we would recommend at least 150 minutes of exercise per week. That if you divide that over 5 days duration, it means that you want to exercise 20 to 30 minutes a day, 5 days a week. This will give your heart some degree of conditioning. Now, exercise is important because assuming if you don't exercise, even if your heart is healthy, you might find it difficult to walk up the stairs. That's because one is not fit. If one is fit, when he suffers from heart attack, he's better able to survive a heart attack as compared to someone who is not fit. But having said,
quite an important point.
Yeah, it is important. Always to maintain fit even if one has a problem. Now, for many people, they may have underlying heart disease for which they do not know. So if you have never exercised before and you want to start exercise, I suggest start slow and go slow and increase your pace as well as the intensity over a gradual period of time, because you do not know whether you might have any heart attack. If along the way you find that you are not able to perform like the rest of your peers, you find that you have some chest tightness or breathless, then I would suggest that you speak to your family physician and do a full checkup before you push your heart or your body further.
Okay. Thank you. My last question to you would be, what is LVAD and how does a patient benefit, and what are the criteria? Who are the patient who can take that? Okay.
Now, LVAD stands for left ventricular assist device. Now, it is usually meant for someone with heart failure. What is heart failure? Heart failure means that your heart function is being impaired and is not able to cope up with your normal activity to meet your body's demand. Now, heart failure can be due to many causes, from hypertension to valve problem, but the most common problem of heart failure is that due to blocked arteries. When we have heart failure and you come over to see us, we will first diagnose what is the cause of heart failure, because treatment depends on the cause. You have to treat the cause before the heart failure can improve. Now, assuming that the heart failure is due to blocked artery, which is the most common cause anyway, well, if the patient did not come in too late, the patient can receive surgical treatment such as angioplasty, or they can undergo a bypass surgery, with possible also valve revision at the same time. But as the nature goes, heart is not like liver. You know, when your heart muscle is damaged, over time the heart can progressively get bigger, even if you have done all those procedures as I mentioned. The liver regenerates, but the heart doesn't regenerate. We are not so lucky. We only have one heart. Now, so for some patients, despite all these measures that the doctors have put up, angioplasty and stenting, and the heart function continue to deteriorate such that they have recurrent admission to the hospital for fluid overload, for breathlessness. This patient have an increased mortality. When you are breathless even at rest, we call it class 4 heart failure. Now class 4 heart failure, the 2-year mortality is as high as 50%. And that can be worse than most forms of cancer. Because when women has breast cancer, their survival, 5-year survival is 80%. And men with prostate cancer survival is over 90%.
Right.
So heart failure can be worse than cancer. And in countries for religious reason, you might not have a transplant program, and these guys can still be young in their prime of in early age, and they are very breathless. They are always going in and out of hospital. We might consider this left ventricular assist device as an option, as what we call destination therapy.
Okay.
Traditionally, the left ventricular assist device, or LVAD, is used for bridging to transplant. In countries like Singapore, where we have a heart transplant program, a patient being very sick after a heart attack or due to other reason, we might support them on this left ventricular assist device until a donor heart comes along.
Okay.
But
So it's like a
bridge.
Step, yeah.
It's
like a bridge.
That's
like a
right.
bridge.
We call it bridge to transplant. In some cases, it's used as a bridge recovery because certain heart failure due to virus can be transient. So you support the patient until they recover. But in other patients, advanced heart failure, and you don't have a transplant program, and these people are still young, you might now consider left ventricular assist device as a bridge, as a destination therapy, meaning it supports them. And these mechanical hearts, especially the newer generation of hearts, does not fail so easily.
Okay.
It is very small. It weighs less than 300 grams. It's implanted in the heart with a drive line, and the patient can lead a practically very normal life.
Oh, that's lovely.
And based on our experience, the newer generation of device called HeartMate 2, there's more than 10,000 cases implanted worldwide.
Okay.
With the oldest living, is more than 9 years after the artificial heart, this is being implanted in them.
Oh, it's a wonderful news.
Yes.
And definitely my viewers will benefit, Dr. Tang, thank you so much for sharing your views with us, and Dr. Chuang, thank you so much for giving hope to those people, who has heart failure and that they have a hope. And Darshok Mondali, Dr. Tang and Dr. Chuang এর কাছ থেকে আমরা জানতে পারলাম লিভার ট্রান্সপ্লান্ট সম্বন্ধে, যে লিভারটা যদি আমরা ডোনেট করি, অর্ধেক লিভারটা ডোনেট করা যায়, এবং নট নেসেসারিলি আত্মীয় হতে হবে, যে কেউ দিতে পারে, এবং লিভার সেলটা রিজেনারেট করে আগের সাইজে চলে আসতে পারে। ডক্টর চুয়াংয়ের কাছ থেকে জানতে পারলাম যে যাদের হার্ট ফেলিওর হয়, যাদের মর্টালিটি রেট খুব বেশি, তাদেরকে তাদের মর্টালিটি রেটটা কমাবার জন্য তাদেরকে একটা ব্রিজ হিসাবে লেফট ভেন্ট্রিকুলার অ্যাসিস্ট ডিভাইস দেওয়া হয়, এবং তারা খুব সুন্দরকে সেটা দিচ্ছেন, এবং তাতে পেশেন্ট যাদের হার্ট ফেলিয়ার আছে, যারা নর্মাল কাজ করতে পারে না, তারা রীতিমতো একটা নর্মাল লাইফ লিড করতে পারেন। তো দর্শক মণ্ডলী, আজ এইটুকুই থাকুক। আশা করি আপনারা উপকৃত হয়েছেন আমাদের এই আলোচনার মাধ্যমে। আজকাল মেডিকেল সায়েন্স এত এগিয়ে গেছে যে এই অনুষ্ঠানের মাধ্যমে অ্যাকচুয়ালি আমরা ভিউয়ার্সদেরকে জানাতে চাই যে কোথায় আজকাল টেকনোলজি চলে গেছে, আমরা কোথায় ভালো ট্রিটমেন্ট পেতে পারি, এবং কি করে সুন্দর জীবনযাপন করতে পারি। সবাই তো বাঁচতে চায়, কেউ এই দুনিয়ার মায়া ছেড়ে তো কেউ যেতে চায় না। তো আজ এইটুকু থাকুক, আগামীতে আবার দেখা হবে। সবাই ভালো থাকুন। খুদা হাফিজ।
There are 250 medical suites in this building, and we have specialists ranging from neurosurgery, cardiovascular, anything you can think of. You have the best of the best working in this hospital.
The clinics are actually linked to the wards on every floor, and this is really important for us because it allows us access to our patients in the wards at all times, and enables us to keep a really close watch on them while they're recovering.
What's really impressive is that access to advanced medical treatment can be done within 48 hours. A simple weekend away for medical treatment is now a real possibility within my busy schedule, and that's life-changing.
The staff, they're really warm and professional, and they always greet you with a smile, and that's fantastic.
This hospital is really on top of technology, and I particularly like the other touches of technology that kind of completes the experience. There's Wi-Fi everywhere, and I can keep in touch with my family and stay online. And the patient console is a unique and nice feature that keeps everything within reach, like ordering food and of course selecting entertainment channels.
I've been a professional chef for the past 20 years. We have catered to many events and many products. But it's the first time I'm doing an opening for a hospital that position themselves 6-star. We have a cross-cultural menu that includes a symphony of cuisine and different cooking techniques as well as variety on the menu. We believe that by offering this kind of variety is sort of an excitement for the clients, that there will be something that they definitely want to look forward to for tomorrow's meal or the meal that's coming after.
No effort is spared in making sure that patient privacy, patient comfort and patient safety is not compromised in any way.
I like the garden very much, and the fountains and flowers. It's a very beautiful place.
A hospital that harmonizes the best technology with nature. It's possible.
The best of medical specialty under one roof. It's possible.
An exceptional team with extraordinary touch. It's possible.
A 5-star hospital cuisine is possible.
Care, comfort, and complete privacy. It's possible.
The hospital of tomorrow, here today. It's possible.
Service quality and speed with a human touch. It's possible.
Revolutionizing and setting a new paradigm in private healthcare. It is possible.